I am pleased to give you some new updates on our free statewide tobacco treatment service. And let me see if I can work this right. I have nothing to disclose, no conflicts of interest. I encourage you, I mentioned this last year, but I encourage you to check out our website, which is still new enough to call it new, at quitnowsc.org. So for all these years at DHEC, we've depended on DHEC's website, but now we were allowed to, got permission to have our own dedicated website. So please check that out. We're in the process. There will be a few updates that have to be made, but by and large, it is raring to go, so please check it out. And of course, at the top, you will see the top left corner, you'll see our Quitline logo with a little bit of rebranding that we did. Okay? Some of you may or may not know, but Quitlines are not new. They are free treatment services for folks who use any tobacco product, and now mostly vaping and tobacco. We call these quit services. You will see me using less and less the term cessation that no one can pronounce. It's either sensation or sexation or cessation or whatever, but that's nothing new. So we use that term less and less because we talk about treatment, nicotine dependence, and quit services. These services are free, and as I said, it includes tobacco products and vaping as well. Our services focus on behavioral counseling that's delivered by coaches and FDA-approved medication. A coaching team supports folks who enroll with the Quitline for services. Every state, U.S. territory, and Canadian province has a Quitline, and we are well represented because the CEO and his colleague, Vince Talbot, actually hail from Canada. They actually flew in from Canada for this meeting. I think they came further than any of you. The South Carolina Tobacco Quitline launched in 2006, so we've been around for a while, but we're actually the baby Quitline. We are the last state to have had a Quitline. States like California have had a Quitline for like 3 decades. Our services are free. No insurance is required, so there's no hassle there. There's no coding, billing, reimbursement, things like that. Coaches are trained tobacco treatment specialists, and they connect with participants via phone, text, or online chat. We like to say that our Quitline has barrier-free access. We know there's always going to be a barrier somewhere, but in South Carolina, because of our generous budget, which does not come from tobacco settlement money, because South Carolina didn't get any to speak of, which our Quitline is not supported by tobacco settlement money or federal dollars. We're very proud of that. But we do provide as much barrier-free service as we can. And because of our budget, we have been able to expand services gradually over the last several years, and I'm very proud of that. We are open 24 hours a day, 7 days a week, except major holidays, but we are open on New Year's Day because we all know somebody's going to make a New Year's resolution to quit, at least for an hour. We have multiple language capacity. All diverse population groups are served. So in 2023, what we've done is you didn't know about it, the public didn't know about it, but we knew about it, didn't we, Catherine? That March 1st, we seamlessly transferred over to a new digital platform of services. It's much expanded services that we are offering now, more individual preferences. We do include all tobacco and vaping products. We have a more health-focused, holistic approach to working with our participants. There is a new dashboard experience where participants can access articles, social media resources, apps, etc. It's going to be a whole wealth of information to help support them in their journey to quit. We provide now group counseling, which is something we've never done before. We also offer chat sessions with coaches on their phone or on the internet or however they want that. We obviously still have the telephone-based services for sure. Those are not going away. And we have a streamlined enrollment process with just one person, which means that now when someone calls the Quitline, they don't go through intake with the registration specialist. They go directly to a coach, and the coach gets them started and answers questions and collects the data, as well as gets them started on their quit journey. We have improved enrollment options that I'm very proud of. I don't know how many more ways you can enter and access the Quitline, but you can call because we're still going to be a Quitline and we're still going to have phone lines. And we access English, Spanish. The 7 AI Quit is for American Native Indian, our original American Indians. TTY is for the deaf and hard of hearing. You can text for English ready to 34191, or for Spanish, they can text LISTO to 34191. And then there's a vape-free texting enrollment access as well. Or they can click and go to online, just go to quitnow.net /South Carolina. And on that web page, they can toggle to Spanish. So click, call, text are the ways to enroll with our Quitline. And we're very proud that we can open up all of those options. Our Quitline serves ages 13 and up. A lot of people think it's 18 and up, but we actually start serving at age 13. We have a dedicated Spanish line that I've mentioned, Deleho Ya. Native American Indian dedicated phone line, which is AI7 Quit. Deaf, hard of hearing, I've mentioned that. All others are transferred to someone automatically who speaks their preferred language. So if we don't, Quitlines, our vendor obviously has the capacity to serve multiple languages. So they will get transferred immediately to someone who speaks their preferred language. And there's multiple options to access a coach, phone, text, online, individual, or group chat sessions that I've already mentioned. The new and improved services, our new program is called Coach Plus. We offer 5 sessions to anyone who wants traditional coaching, either any of their choice of method. They can talk on the phone, they can text, they can communicate via text, or they can communicate online and chat, either in a chat room, or they can communicate directly via online with their coach. We provide unlimited inbound support via all of those methods. I've already mentioned they have online access to articles, courses, trackers, and more. That new digital dashboard experience is there. And they can only work with digital services if that's what they prefer. And then we have our strong text message support program. Right now it's single directional where they're getting text message support, but we are working on having bidirectional text messaging. We provide combo NRT, which is patch plus gum and patch plus lozenge, which is evidence-based to show a stronger support of quitting. We provide up to 12 weeks of combo therapy dosing for uninsured and Medicaid, and we provide a quicker 3-day shipping of NRT products. This is a new thing, and this is a big, big deal. Used to be it would take between 7 to 10 days for the shipping to happen with the NRT, and now there's a 3-day turnaround, barring what happens with the mail. But we're really happy on the 3-day shipping of NRT products. We maintain what we call a 7-session tailored program for pregnancy, behavioral health, American Indian, and a Live Vape Free and our youth programs. These are customized programs that have customized protocols, customized materials. Now, we've got all materials to cover any population that calls. But we provide these individuals a more intensive program with coaching support and, if they're eligible, with the NRT product support. All right. We have carved out services. I just want to mention a little more about these. With our behavioral health program, we have a very strong behavioral health program. You've already heard from Dr. Eve Fields, and don't let her tell you wrong. She is our psychiatry champion in mental health in South Carolina. I call her our Chad Dingman of mental health, because Chad's our oncology champion. And y'all, let me tell you something. If you do not have a champion, you're not going to get anywhere. I can have all the doctorates I want, but I don't have an MD. And so she can speak to her colleagues much better than I can. But we work strongly with tobacco users who have co-occurring mental health conditions. And then our DHEC partners. Is Tracy here, Tracy Belcher, or anyone else from DHEC? There you are. So she's our other champion partner. Our DHEC partners are just strong partners. And Eve mentioned about the group that we have, the partnership, and Lamar Suber was part of that. This is a strong partnership, and we are one of the people that had we're one of the states that have a better partnership than anything, than most others. We work with pregnant postpartum women through their pregnant phase and into postpartum phase to prevent relapse. American Indian program serves these folks with culturally sensitive materials and coaching. A Live Vape-Free program serves 13 to 17-year-olds. And then our menthol and smokeless tobacco programs, we have coaching, customized coaching for those as well. So I'm running out of time. I just wanted to throw this up. Are you going to post the slides? So here's our vaping program that I kept this slide in from last year because I know so many people are concerned about vaping. And then our provider services program, I left this in as well, about our very robust referral program, and then our health systems, other systems program as well. We have served about 187,000 people since we started up. We've had over 52,000 provider referrals. We have one of the highest successful quit rates in the nation, 42% for those who did the individual services program and 40% for those on the phone. 98% satisfaction, and we save over $1 for every dollar spent. Catherine, if you'll come on up, because I know I took too much time. I'm sorry. My word. Okay, Catherine's going to give us some great data.
All right, so I'm going to, hit some high-level data. I'm going to dig a little bit deeper. Obviously, the Quitline has a lot going on, so there's a lot of data. So the South Carolina Quitline has seen a steady increase in enrollment post-pandemic when Quitline enrollments were down across the nation. As you can see, we had 8,188 South Carolina residents enrolled in the Quitline in 2022, which averages about 682 a month. In terms of type of tobacco use, we have also seen, this isn't going to surprise anybody, but an increase in the number of participants who report using e-cigarettes. With 1,480 participants in 2022 reporting e-cigarette use, this number has more than doubled since 2020. Interestingly, just really quickly, the number of participants reporting using smokeless tobacco has decreased each year since 2020. And then, as Dr. Wynne mentioned, there are a number of ways for providers to refer to the Quitline, and we are very fortunate to have providers across the state who refer patients to the Quitline every single month. So this is another area of strong growth for the South Carolina Quitline as we continue to receive more and more provider referrals each year. So who are the South Carolina Quitline participants? You'll see that more females than males enrolled in 2022. And there's a wide range of ages at which individuals decide to quit tobacco via the Quitline. Obviously, as Dr. Wynne mentioned, we start at 13 and go all the way as old as you get. The majority of participants are between 51 and 70 years old for 2022. In terms of race and ethnicity, Quitline enrollees align with the overall state demographics, actually, with about 65% of participants identifying as non-Hispanic, white, or Caucasian, and 29% as African American or Black. So we also collect information on educational attainment and language. The most commonly spoken language is, of course, English. But we also had one participant in 2022 who spoke Korean, so I thought that was interesting. All right, quickly, since we know tobacco use both contributes to and worsens chronic diseases, Quitline also collects data on this as well. The most commonly reported chronic condition was COPD. We also look at diabetes, asthma, I lumped together CAD, CHF, and hypertension, and then cancer. Finally, this is my last slide. Since the Quitline has a carved out program for individuals with behavioral health conditions, and we've talked a lot about our strong partnership with our behavioral health partners, we also track Quitline participants who report these conditions. In 2022, the top 3 reported behavioral health conditions were depression, generalized anxiety disorder, and bipolar disorder. And this is our contact information. We'll get ready to hand it over.
Well, I'm so pleased to be here. My name is Peter Fallis. I'm the president and CEO of TelASK. I'm accompanied by a couple of my co-workers, Vince Talbot and Aaron Greenwell, and we'll tell you a little bit about our platform. TelASK, we call our smoking cessation product Quit Manager, and it's a cloud-based platform up on the Microsoft cloud. We integrate with hospitals and clinics. We provide a suite of helpful tools for tobacco treatment specialists. We automate the follow-up of tobacco users and triage them to the South Carolina Quitline. And very important, we generate a mountain of data on all of these interactions. We're HIPAA compliant. I mentioned the Microsoft Cloud, and we always sign a business associate agreement with each one of our entities. Right now, we're up with Gibbs Cancer Center, SC Oncology, SCOA, and Hope Health. And we're in the progress of working with the Center for Pediatric Medicine, Prisma, and Aiken Regional. We're talking with Sandhills Medical Foundation and McLeod Health. So what our platform does is it pulls data from the electronic health record. We are integrated with Epic, Cerner, Allscripts, Athena Health, some of the cancer platforms like Flatiron, Area. And we're also I'm very happy to be available through the Epic Connection Hub. Epic is one of the larger electronic patient records, as you probably know. So one of the things that we do, because tobacco is a chronic relapsing condition, even though when a patient who smokes is at the hospital, it's a teachable moment, they're not always ready to take the call to action. So what we do, and it's kind of our secret sauce, is that we reach out to the patients several times, in fact, up to 6 times over the course of 6 months. And we do this with automated voice calls. We do it with email. We do it with text messaging. We try to meet the patients where they want to be met. And this idea of sequencing the calls out and the communications out to the patients is important, because not everybody's ready at the same time. And what we hope to do is kind of land in on them when they're ready to say yes. And the evidence is very, very clear in our data that the quicker you can hand somebody from one of these communications over to a resource that can actually help them, the more successful they are at quitting. When these automated calls, and I know you hear them called robocalls, and our calls are not like those calls that arrive at supper time and offer you a trip to the Bahamas. They're personalized. We address patients by their name. There's a call display, and that call display is customizable. Sometimes we say help to quit. I know that here in South Carolina, we're saying SC Oncology. We're saying SC Oncology. We're saying, I believe, Gibbs Cancer Center. We say Hope Health on that call display. So when people see the call coming in, they have some idea of where it's coming from. We can customize the call flows, the scripts that people hear. Different populations would respond to different messaging. When we were hearing earlier about psychiatric patients, I couldn't help but thinking that the messaging could be tailored to those patients, particularly, so it could resonate better. We always include a motivational message, and we always offer an opportunity to connect the patients to the Quitline. Before the calls go out, we send out a welcome email, and this alerts them to, if they take that email and read it, it tells them that they can expect a call, and that helps promote the success. We also send the questionnaire or the interaction itself by email, and there's a link in the email that times out at midnight that night. But if they respond to the email and the questioning in the email, the data is all gathered into the same database. Same with text messages. And so I'd like to show you now some of the data that we're seeing here in these programs. Gibbs Cancer Center got live back at the beginning of 2022. And you can see here that there were actually, up till the end of March this year, 2,623 enrollments in the program, and 752 people actually took the call to action. That's almost 29%. We expanded later in late 2022 into the low-dose CT scanning department, and there we've seen 966 enrollments with 258 people accepting the call to action. So all in all, that counts up to nearly 3,600 enrollments and over 1,000 referrals. At SCOA, they got started a little later. We've seen 1,874 enrollments, with a third of them almost accepting a referral to the Quitline. Hope Health just got rolling with a pilot with a few providers, and they've had 108 enrollments and 9 referrals, but it's going to grow, I'm sure. So statewide, 5,574 enrollments, 1,500, nearly 1,600 referrals to the Quitline, and that's almost 30%. Now, another interesting thing for all the statistics hounds out there, because we're gathering all of this information out of the patient health record, we get all of the demographics along with that data. So we're able to take a look at just who is being reached, who's enrolled, and you can see here, these slides, by the way, will be available to you if you're interested in the stats. But more females than males. The breakdown, the race breakdown is there. Caucasian, 1,988, blacks, 610. You can see the age is, there are many more enrollments later in life, obviously. And in the low-dose CT scanning, it's about even between the genders. It is about the same as it was in the other group for race. And of course, with the low-dose CT scanning, you don't qualify till you're over 50. So That explains that last statistic. And that's really a snapshot of what it is we do. Our program, by the way, is an opt-out program, so that everybody who's identified as a tobacco user in these organizations who's a patient passing through is automatically opted into the program, and they need to opt out in order to not participate. And that is truly a secret to success. And here comes Chad.
Peter lied. We're not going to do questions. Not until I'm done anyway. And I realize that I am the person keeping you from lunch, and being well aware of that. I'll be quite brief with this. For those of you who were here last year, I was here as we just rolled out the program, and those numbers were nowhere near where they were. But one thing I wanted to reiterate before lunch, and I think it's so important, Kelly had mentioned it, Jewel had mentioned it, Dr. Fields mentioned it, Katy had mentioned it, and I'm aware of this. I'm a recovering clinician. I was a clinical social worker for about 15 years, and I've been in administration. And so I think what's really important for everybody is it's not always the message, it's the messenger, and how important that is to take with you as you move forward. When I was in the clinic and a physician would ask me to go talk to a patient, that carried a certain weight as a clinician. And then I became an administrator, and I sat at a different table, and now it has a little bit of a different meaning coming as a director of a part of a cancer center. And then if you can find your physician champions, you can find all sorts of different people who can send that same message and get enough of the right messengers, it's going to stick with somebody. And so when we rolled our program out, I was kind of a one person. Katy kind of lured me in and said, we really want you to do this program. I found some physician champions. We really started to embed this into, look, if we can't agree that quitting smoking as a cancer patient isn't the right thing to do, we've got too much work to do. And so we did an opt-out program. We used to do opt-in, and the difference between the two is, Katy, I'm going to use it. Opting in is fishing with a pole. Opting out is fishing with a net. Okay? We don't have the resources to talk to 3,600 people. And again, the relationship with somebody, a cold person coming in to say, your doctor told me to quit smoking, we're not going to be very successful in doing that. And what I've been amazed with our data is to see how many people sign up for services at day 30 and day 60. They've received text messages, emails, and phone calls 7, 8, 9 times. And for whatever reason, that 10th time, they decide, I'm ready. And so this all happens behind the scenes. I don't have people on the phone or doing computer work for this. It's been a wonderful process for us. You saw our data. It's wonderful. I'd be more than happy to talk with you about how to roll this out. Show of hands. You're incriminating yourself. Who are my healthcare people in the room? Anybody from hospital institutions, right? It's like turning a cruise ship around on a lake. None of this stuff happens quickly. And so again, it's reiterating the message. It's finding the right messengers. It's championing with people. It's getting with the Katys and the Peters and the Aarons of the world, getting the data. And so I think it's a mixture of having both sides. The clinician in me knows it's the right thing to do. And now I have the data to back up that of this is what we're doing. Because what they didn't show, and what I showed Aaron this morning is, and this is the social worker in me, I'm more concerned about somebody's journey than their destination. If someone says, how do you define success in your program? It's not who quit smoking, it's how many people I gave access to have that opportunity. And so when I look at those numbers, that's encouraging. Now, the destination side shows me that we've had over 160 people who have signed up for services through the Quitline. And so, again, the clinician side says, that's 160 mothers or fathers or brothers or sisters. That's important. You can't get lost in the data of numbers. These are people's lives we're trying to change. And you saw our low-dose-CT program. That's a group that we've just launched recently. Obviously, they qualify because they're having a low-dose CT because they're smokers. You saw the age range there. Next spin for us is looking really at our cardiology service line. We know we have some issues with smokers and heart. And so talking with my cardiology colleagues at the hospital, trying to roll this out to certain groups of people. So we've been very, very excited. Again, it's been very transformational of what we're doing behind the scenes and really changing the lives of our cancer folks. And again, any questions, come find me at the break. I guess my contact information is not on there, but I'd be more than happy to share that with you. And now, is there any questions for Peter or Katy or myself?
Questions?
I don't have a question per se. Hi, I'm Sharon Biggers. I'm the director of DHEC's Division of Tobacco Prevention and Control. And thank you, panelists, because that was a wonderful presentation. So exciting to see. But I just wanted to really highlight the importance, Chad, of what you've done in incorporating your low-dose tomography screening into this whole system, because that's such an important crossover that was not necessarily an intentional part of what we started with Can Quit, but a brilliant move to be able to offer cessation to the folks that go through that screening. And that's an important step in that screening. So I just want to commend you for coming up with that and working with the team to get that going, because that's a brilliant kind of offshoot. And I'm thrilled to hear about the cardiology piece as well.
I'm totally taking credit for that, since you said it was brilliant. That was my idea. And I guess, another fascinating thing besides the fact of how many people sign up late is, and I'm going to age myself here, is the phone call aspect is really kind of, as a behavioral scientist person, I'm always curious. When I was a kid, the phone rang at the house and you answered it because you're just excited to talk to somebody. And then this time came maybe when I was around in college that had caller ID, so you knew who was calling you. And so you decided if you wanted to answer it. And then the whole cell phone. And now it's really fascinating. What I'm finding is people wait and look at the phone call and it says Gibbs Cancer Center on it, and they don't answer it. And then they immediately call it back to see who it was. And so I think, as learning these types of things, okay, if we put a generic number on, people are going to ignore it and report it as junk. So now we got to tie our name to it. So now we tie our name to it. We have to have a mechanism for when they don't answer it and call back. We have to have a pretty explicit telephone message of why and who this is. And so we enlisted one of our cancer center staff people, Chantel, who's a Southern person, right? We want that to have a warm voice. If it was Chad the Midwesterner giving you, no one would want to listen to me. But Chantel has the sweetest voice. You would never want to say no to her. You want to answer the phone and ask and answer her questions because she does it in such a polite way. And so I think you look at the scripting and the emails and all the different ways to reach people, it's important. And so, yes. And again, I think now we're realizing through data, and any of you who are, like I said, are in healthcare epic, we have 10,000 identified people in our catchment area, which is Spartanburg, Union, Cherokee. That's our cancer center reach. We have 10,000 identified people who qualify for a low-dose CT screening who have not been ordered one. So you're looking at people 50 and older with an identified smoking history, 20-pack years, 10,000 people in a 3-county area. That is an enormous amount of people that we are trying to reach. And so, Katy, we're trying to provide you and your group with job security. I'd like to think a lot of those numbers you're seeing are people from Gibbs, and we're going to continue to grow it because it's the right thing to do.